Dr. Jaffe, are there any tests one can do today to measure one's general health without actually seeing a doctor?
Well, upstream primary prevention includes 4 self-tests that we recommend. These 4 self-tests are first morning urine pH, GI transit time, the C cleanse, and hydration. These are self-tests. You can do them at home. You can access them through a consumer portal called betterlabtestnow.com and use these 4 self-assessments to determine how much magnesium and choline citrate you need based on the first morning urine pH. And how competent is your digestion based on the GI transit time, which should be 12 to 18 hours? And how much ascorbate does it take to cleanse? How much ascorbate does your body need to fill up its ascorbate antioxidant tanks and to help move the needle? The amount of ascorbate that you need determines how much antioxidant stress you're under and how much oxidative harm you need to reverse. Ascorbate is the maternal antioxidant. And there's a skin pinch test for hydration that you can obtain the instruction through Better Lab Test Now. Now, we also offer 8 predictive biomarkers through BLTN, through betterlabtestnow.com. And these cover all of epigenetics, all of lifestyle and the habits of daily living that add up to lifetime morbidity and mortality, your duration of your life and its quality, and how much suffering you will have during your life. Hemoglobin A1C assesses the average sugar stuck onto protein. The more sugar there is, the more harm it gets done, the more biological stuckness, the biological slipperiness, biological extra sugar causes harm. High sensitivity C-reactive protein, HSCRP, assesses inflammation and autoimmunity, and it should be less than 0.5. Homocysteine and methionine ratio for methylation and repair of cardiovascular systems, and it should be less, the homocysteine in plasma should be less than 6. LRA is an ex vivo cell culture test to determine burdens on the immune defense and repair system, and you should have as few burdens as possible and take the time to improve your overall metabolism, digestion, and extraction of nutrients by having LRA ex vivo cell culture results as well. We talked about urine pH, how important it is to determine the amount of magnesium and choline citrate, the doses needed throughout the day. Desirable pH is between 6.5 and 7.5. If the pH is below 6.5, every half pH units, you add an additional dose of magnesium and choline citrate. So you take 2, 3, 4, or 5 doses of 220 milligrams elemental magnesium along with 1 teaspoon of choline citrate to triple the uptake of magnesium and avoid magnesium buildup in the gut. The 6th is vitamin D, its desirable level being 50 to 80. The average American is less than 20, which increases the risk of all chronic autoimmune, inflammatory, cardiorespiratory, cardiorenal, and other autoimmunities. Omega-3 index checks your essential omega-3 to omega-6 balance. It should be more than 8%. And the 8-oxoguanine is an unusual urine test to assess nuclear DNA vulnerability. These 8 predictive biomarkers, interpreted to best outcome goal values, are a new paradigm shift towards healthier, more alive, more worthwhile living, to feel and function better for the entire duration of your life. Whatever your age might be, you can function decades younger by following these 4 self-assessments and these 8 predictive biomarkers available to you as a consumer through betterlabtestnow.com. So make use of these tests now that they're available on a consumer portal, and be well.